Welcome, everybody. Thank you for joining our webinar this afternoon or morning on the West Coast, valuing the strengths and building solidarity in home-based childcare. Our intention is for this meeting to be offered in both English and Spanish. So I'm going to welcome and turn it over to my colleague, Lynette Garcia from the Community Language Co-op to get us set up with a simultaneous interpretation.
Gracias, Natalie. Thank you so much, Natalie. Muchas gracias a todos por estar aquí el día de hoy. Bienvenidos a este seminario web. Thank you so much for being here today and for being part of this space. En cuanto se aprende la interpretación, Homegrown está dedicado y está comprometido más que nada a practicar la justicia, el acceso al idioma, ¿verdad? Donde todos puedan conectarse en el idioma de su corazón. Homegrown is dedicated to practicing language access where everyone can understand in their heart language. As soon as interpretation is turned on, you'll see a globe at the bottom of your screen. Van a ver un globo terráqueo abajo en su pantalla, donde pueden seleccionar el idioma de su corazón, where you can select your heart language. We ask that you please, if you have any questions, if you have any troubles, that you do not suffer in silence, that you let us know in the chat so that we can support you with interpretation. Por favor, no sufran en silencio. Si tienen alguna pregunta de cómo aprender la interpretación, nos dejan saber en el chat para poder ayudarles el día de hoy. Spanish is 15 to 20% times longer, so please be aware of your pace. If there's any questions or anything that comes up, we ask you to please be aware of that pace. Por favor, el español es 15 a 20% veces más largo que el inglés, entonces estén al tanto del ritmo de lo que están hablando, si hacen alguna pregunta. Also, please let us know if there's anything else that we can support you. If you're on a tablet as well, there's going to be three little dots to the right. You won't see that interpretation button. You're going to have to go and select that in your three buttons that you see to the right if you're on that cell phone or tablet. So please be aware of that and select your interpretation there. Si están en una tableta o un celular, por favor, seleccionen los tres puntitos a la derecha donde pueden seleccionar el idioma de su corazón, por saber un poquito más diferente. Creo que eso es todo. I think that is all. Thank you so much. Muchas gracias.
Thank you, Lynette. If everybody can just take a moment to select your language in the interpretation area. We're excited to have you with us today. In our discussion today, we will welcome you and we will share a bit more information about Homegrown, and then really spend most of our discussion talking about the community that Homegrown is building alongside each of you, including both family childcare and family friend and neighbor caregivers. We will be joined by a panel of providers and a funder talking about the importance of building and sustaining this community together, and then talk more about opportunities to work together to advance change in our sector. We welcome your input in the chat and would ask that if you want to share questions with the presenters or the panel, that you use the Q&A function. So for those of you that may be new to learning about Homegrown, we are a national collaborative of funders, caregivers, and providers working together to advance an inclusive childcare system where home-based childcare is visible, valued, and well-resourced. We work in partnership with the diverse array of family childcare providers and family friend and neighbor caregivers who comprise the home-based childcare sector. Today, joining me in this presentation, my name is Natalie Renew. I'm the Executive Director of Homegrown, and I'm joined by my colleague, Vinette Pierre, who is our Communications Manager, and by Haley Village, who chairs the Provider Advisory for Homegrown. Later in the presentation, we will be joined by a panel that I will introduce at that time. But now I am really excited to turn it over to Haley to welcome you all to this meeting.
Welcome, everybody. Good morning or good afternoon, wherever you are located. A little bit about me. My name is Haley Village. I am located in San Mateo, California, which is about 23 miles of San Francisco. What started as, I've been in the childcare space for about 40 years. The first 20 years, I was working for the nonprofit sector. And then about 20 years ago, I started as a FFN, something that I actually didn't know that term until I joined a homegrown. And then for the last 17 years, I actually became a licensed family childcare provider, caring for children from 0 to 5 years. Sorry, I'm a little bit nervous. Um, when I was asked to talk today, I was asked to talk about kind of my journey here in homegrown. And what I really wanted to specify was 5 years ago, I was asked to join the advisory panel. Initially, I was a little skeptical. I felt that a lot of organizations, they offered very little support to me as a family childcare provider. And when I did first start my family childcare, my children were very young at the time, and there really wasn't any time for extra anything. I was open Monday through Saturday, and when I closed my doors, then it was time for my three children running from school events, volleyball, basketball, baseball. Sorry, I'm talking a little bit fast. And so there just wasn't time for me to do much of anything. However, when I was approached 5 years ago, my children were older, things had settled down, and I went and I listened and I thought, wow, this seems a little bit different. It was one of the best decisions I made. I was very nervous the first 3 or 4 sessions that I joined. I was in these sessions with these amazing powerhouses, these women, these providers, talking about things that I knew nothing about. I wasn't involved in the political side of things. I didn't know a lot about advocacy. As a family childcare provider, we are very isolated in our home-based programs. We are looking after the children. It's a day to day, and I didn't have time to really do too much of anything else. Through my journey with Homegrown, I felt empowerment through connection. I've been introduced to a network of individuals, advocates, change makers, powerhouses that are shaping the childcare industry, especially family childcare. What stood out to me most was the genuine connection of asking, what do you need as a family childcare provider? And really asking for not just my professional story, but me personally. What am I going through? What are the challenges? What are the successes? And how can Homegrown walk with me in this journey? And it's been one of the best feelings to meet these amazing people that have helped me in advocacy and leading a journey of learning more about things that can be done to support our field in general. Thanks to Homegrown, I've gained access to invaluable tools. I've been part of panel discussions. I've been in interviews. I've had a platform to amplify not only my voice, but the voices of all family childcare providers, not just a select few. Their support has been deeply personal to me. When I faced a serious health crisis and couldn't qualify for state benefits, it was the network through Homegrown that they walked with me and they supported me during that time. And I will never be, I cannot say enough thank yous. They've connected me to resources and guided me through addressing challenges like home ownership in the Bay Area, which is extremely expensive. I found my voice through Homegrown, through advocacy and sitting in on panels and talking to my peers and my colleagues. It's been very short, it's been a blessing. It's been empowering to step into leadership roles, which has allowed me to go before my local officials, before my mayor, before my board of supervisors, and advocate for children and families and fellow educators. I was very recently the advisory panel that I've sat on. I was now asked to chair this panel of amazing ladies, the 7 women from across the United States. Together, alongside these providers, there's 3 FFNs, family childcare, family and friend and neighbors, and 4 family childcare providers. These women are Gladys from New York, Adrian from Philadelphia, Melody from Chicago, Ruth from Minnesota, Chris from Vermont, Carmen from Colorado, and Margarita from California. They're not only amazing colleagues, they are community ambassadors, and it's a privilege to work with them side by side. We support one another, we ask questions. I can call and say, hey, I'm thinking about doing this. Do you have an idea? And it's nothing more than a blessing. So I'm honored to be part of Homegrown, and the journey doesn't stop here. I look forward if Natalie or Karen call me and tell me, Haley, can you do this? Can you be? I'll say yes before I even know what they're asking me to step up to do. So thank you for being here. We'll welcome you to take part in anything that Homegrown is given. And if there's any support or questions you have for me, please feel free to reach out. Thank you, and I'll pass you back on to Natalie.
Thank you, Haley. We so appreciate your leadership within Homegrown and within your community. And really appreciate the contributions of our provider advisory who guide us in the work that we do. So I'm going to share a little bit of information about Homegrown, and then we're going to talk more about the community that Homegrown is bringing together. So Homegrown envisions a country where all children have the care they need to grow, learn, and thrive. It is our mission to build a more inclusive childcare system that values and supports home-based childcare as a quality option for families and children. We know that families already do value home-based childcare, and we want to ensure that public systems and public resources do the same. For us at Homegrown, we are deeply rooted and are guided by our core values that inform all the work that we do. So I want to take a moment to share those values with you. Firstly, we honor and amplify the diverse provider and community experiences. We value and respect the ways in which providers and communities choose to engage with and influence the early childhood sector. We follow their leadership, attend to their individual needs, amplify their voices, and support their aspirations for change. We are committed in our values to operate in solidarity with community, to amplify the power of people coming together to transform their own lives and improve the lives of their loved ones, their neighbors, and their communities. We elevate the perspectives of those most marginalized because addressing their needs and building their visions for the future will benefit us all. We recognize collective power and action. We know that the current systems marginalize and exclude parents, families, and providers from decision-making around the issues that affect them most. We seek to be in relationship with providers and parents to learn from their wisdom and experiences and to fuel the solutions that they identify as best meeting their needs. We seek to build community ownership. Any solution is not sustainable if owned by a single entity. We partner and collaborate to ensure that solutions are owned, adapted, and scaled within community. We foster innovation for better outcomes. We operate from a place of abundance, and we refuse to accept a notion of scarcity. We believe change is possible, and we are willing to disrupt the status quo to better serve the needs of children, families, providers, and communities. We use our voice, our relationships, and our platforms to advocate for change. And lastly, we serve with excellence. We are driven by a commitment to serve communities and providers with excellence. At every level, individual, program, and organizational, we hold ourselves and each other to the highest standards of integrity, quality, and performance. These values are deeply informed by our advisors, and we've worked hard to ensure that they can hold us accountable to them in the work that we do. So I'm now really excited to turn over this presentation to my colleague, Vinette, who will talk more about the community that we bring together at Homegrown.
Thanks, Natalie. It's really exciting to be able to talk about this inclusive community of home-based childcare providers that we are so privileged to be able to build here at Homegrown. So I want to first talk about the definition of home-based childcare. Homegrown defines home-based childcare as any care that is not in a center-based or institutional setting. And so under this umbrella of home-based childcare, we have family childcare and family friend and neighbor childcare. So family childcare. Family childcare is also known by many other names, which we'll talk about later in the presentation, but typically known as family childcare homes, family daycare homes, etc. Family childcare provides care and education outside of a private residence, typically as a business. Family childcare providers typically are paid for their services, and that's a unique differentiating factor between family child care and family friend and neighbor care. I also want to make sure that I share that homegrown embraces the terms that providers and caregivers use when self-identifying. We celebrate that providers use different terms to identify themselves, such as educators or business owners. We welcome and celebrate all these terms. These are the terms that we use under the umbrella when defining family child care and family friend and neighbor care. So family childcare, there are approximately 95,000 open FCC providers, and this is according to data from Child Care Aware of America in 2022. And there are different types of FCC providers. So there's licensed and registered. These providers typically meet a set of requirements outlined by their state in order to participate in services and operate. They're, again, usually typically paid for their services. And some states use the terms regulated rather than licensed. And so there's usually, differences there. And also some states distinguish between large and small family childcare settings, and those settings may be regulated differently. Also, there's license exempt family childcare. These providers typically are not required to obtain a license because they care for a smaller number of children. They're also typically paid for their services, and states typically set specific thresholds for providers depending on whether they're considered licensed or regulated. And so there's such a continuum of family childcare providers. We share two examples here, but we really want to make it clear that these are just examples and not absolutes, right? There are so many various ways people can identify as family childcare providers. So here we have Shauna. Shauna is in Pennsylvania. Shauna serves between 2 to 6 children. Last that I spoke with her, she had 2 children enrolled, but she can serve up to 6. She's a sole proprietor. She's licensed, and she's been a childcare provider for 5 years. She started as a childcare provider in 2020 and is just really excited to be able to work in this field, even throughout the obstacles with launching in such a tricky time at the start of COVID. Shauna currently rents her home, right? So that's also something to think about. You can rent or own and still provide family childcare services. And then we have Benu. Benu has been a part of the homegrown community since the beginning. Benu is a large family childcare provider and serves up to 13 children. Benu has 2 employees. She's licensed, and she's been a provider for over 25 years. Benu owns her home in California and is an amazing advocate. She's also the president of the Bay Area Professional Family Child Care Network. And I'm going to just pause here so that you all see the translated slide. I also want to share that oftentimes the decision to becoming licensed is situational. Many family child care providers start off as FFN caregivers and then decide to become licensed, based on their situation. Okay, so now let's take a look at FFN caregivers. Family friend and neighbor caregivers, or affectionately known as FFN caregivers, are caregivers who have typically a previous relationship with the children for whom they care. And so these are your aunts, uncles, abuelas, nanas, just someone in the community typically who has a relationship with the family who cares for the children. So FFN caregivers make up the largest number of home-based childcare providers. There are over 5 million FFN caregivers around the US who care for over 11.5 million children. And this is from NSECE data in 2019. So I'm sure that number has grown since then. These caregivers are very diverse, and the definitions and regulations, again, vary by state. In most states, these caregivers are legally license exempt. They may be paid or unpaid, and they may be eligible to participate in subsidy systems or may not. And this all depends on state. And so again, we share two profiles of FFN caregivers, but we want to also share that, these are just two profiles. There's so much variety among these caregivers. And so here we have Carmela, who is in Colorado. She's been caring for children for over 21 years. Carmela is primarily Spanish speaking. She is pursuing childcare as a profession and a business. She's currently license exempt, and she's experiencing system barriers to receiving resources and bilingual support. And then we have Connie, who is in Louisiana. Connie retired as a program analyst in 2021, and her daughter, who is a full-time nurse, needed support. And so we know that there are a lot of barriers to finding childcare and to being able to find affordable childcare. And so Connie is a situational caregiver who is supporting her daughter with childcare to help with the financial burden of finding outside care. I want to share that many families rely on FFN care, but it is also particularly prevalent in immigrant and dual language learner families. Okay, so variations across states. It can be really challenging to talk about home-based care because everyone uses such different terms. Our work of appreciating and valuing the differences of home-based care is extremely difficult because states just define home-based care providers and the care they provide differently. In some states, providers could be known as family child care homes, group care homes, and even type A home in Ohio is the term that they use. And then each state sets a threshold for the number of children at which providers must be licensed. In states, providers may be licensed as small or large, but the number varies greatly. So in Michigan, a small family child care home serves 1 to 6 children, while in Mississippi, a small family child care facility can serve 6 to 12 children. So there's great variance there in the numbers and the terms as well. Even license varies, with some states instead opting for registered instead of licensed. And then the regulations could be different based on the terms. For example, Texas regulates licensed childcare home, registered childcare home, and listed family provider home types. Most states also recognize license exempt FFN providers, and the provider's ability to participate in state systems vary greatly based on that. Some providers would be considered an FFN caregiver in one state, but not in a different state. And so both the terms are different and the definitions are different. At Homegrown, we want to ensure that everyone knows that we wrap our arms around all of these caregivers, whether you're considered licensed, registered, certified, whatever the term is, family, friend, and neighbor, etc. Our community is really, we want to make sure that our community consists all of these amazing caregivers. Okay, so home-based childcare is a first choice for family, right? However it is defined or named in your state, it is a first choice. Families all across the country and every community, every demographic across the country are choosing home-based childcare. So families choose families choose home-based childcare because FFN care and FCC care provides the support and development children need by offering a loving and responsive setting. Families feel like FCC and FFN care meet their needs, especially with the hours and the availability. FCC and FFN care provides care non-traditional hours. This includes evenings, overnights, weekends, and holidays. FCC and FFN care is also often a cultural and linguistic match for the family. So oftentimes families share the language and culture that their caregiver provides. And FCC and FFN caregivers attend to children's social and emotional development and teach them how to manage their emotions. Loving and responsive care is the bedrock in the home for both FCC and FFN care. FCC and FFN care are both high quality options and important parts of the childcare ecosystem. I want to reference a report that we worked on with Mathematica that identifies the strength of FFN care and the quality in these settings. My colleague is going to drop that into the chat so that you all can take a look, but it really just helps to underscore the importance of valuing FFN care as a quality care option along with FCC care. All right, thank you. I'm going to turn it over to Natalie, who's going to talk about how we're going to work together for change.
Thank you, Vanette. So as Vanette described, while different home-based providers may go by different terms and different definitions in their various states, we are trying and hoping, and alongside each of you, building a community that includes and values all forms of home-based childcare. And, as Vanette described, despite the critical role that home-based childcare providers play in the ecosystem and in supporting children and families, home-based providers often go undervalued and are left out of conversations around policy and system change. This results in low pay, poor working conditions, and limited access to public resources like training and support. This can discourage new providers from joining the sector and has led to a decades-long decline of home-based childcare. On top of the longstanding challenges that home-based providers have faced, we know that this is a particularly difficult moment for home-based childcare providers. Relief funds from COVID have dried up. There are threats to provider and family safety resulting from immigration actions, and there are significant budget cuts being proposed that would undermine the fragile safety net that many providers and families rely on, including Medicaid, food assistance, student loan forgiveness, and housing resources. To combat these issues and to really build a system in which families, children, and care providers can succeed, we believe that we need to work together in coalition across the different types of providers and be in solidarity with one another as we advance a path towards a more equitable and inclusive childcare system. At Homegrown, we see this path to addressing both these longstanding and emerging issues as one that is designed by and led by providers and families, one that builds this coalition by recognizing, appreciating, and valuing differences, but also recognizing that we have a shared goal, a goal of ensuring that children, families, and communities thrive, and that there are opportunities for us to work together to make that happen. I want to share that there are some bright spots around the country where we are seeing transformational policy occur. And in particular, I want to point to California, where home-based providers have the right to organize collectively. The bargaining unit in California includes 60,000 home-based providers, 2/3 of whom, 40,000 of whom, are family, friend, and neighbor caregivers. This group of 60,000 home-based providers have been successful in advocating for rate increases and for benefits like healthcare for the whole home-based childcare ecosystem. And we think there are opportunities for us all across the country to join arms between home-based providers of all different different definitions, different sizes, different levels of proximity to the system to build that kind of political will and to secure better compensation, benefits, and other resources for home-based childcare. So now I'm going to turn to our panel and invite some experts from the field to join us in this discussion. I am so pleased to be joined by Lucy Leon, who is a family friend and neighbor caregiver from Santa Fe, New Mexico. Vantoinette Miss Tony Savage, who is a family childcare provider from Charlotte, North Carolina, and Elliot Brenner from the Klingenstein Philanthropies, who's a funder of Homegrown. We're really pleased to have this group joining us for this discussion. And I'm going to ask Lucy to kick us off and share a little bit about her experience being a family friend and neighbor caregiver in Santa Fe, New Mexico. Welcome, Lucy.
Hola, ¿qué tal? Muchas gracias. Muchas gracias por la bienvenida. Muchas gracias por darme el honor de participar en este espacio con muchas otras compañeras, ¿verdad? Que nos dedicamos a esta labor tan emocionante de ver por los niños, de cuidarlos, de amarlos. Y pues así como lo han dicho, yo vivo en la ciudad de Santa Fe, en el estado de Nuevo México, un estado pionero en apoyar a las cuidadoras. Am, y pues orgullosa de compartir con ustedes un poco de mi recorrido. Yo soy mamá de dos maravillosas niñas y en medio de esta experiencia de la maternidad es que mi vida dio un giro hacia un viaje inesperado que es haber sido FFN. Yo cuidé a mis hijas en casa. Todo esto empezó por la pandemia, como lo habían mencionado. La pandemia también, no todo es malo. Cosas maravillosas se gestaron también en la pandemia. Así es que yo tomé esta oportunidad para cuidar a mi hija mayor en casa y disfruté tanto la experiencia que decidí continuar con mi hija más pequeña. Y bueno, pues en ese momento surgió la necesidad al ver yo a una familia que estaba en apuros por no tener dónde dejar sus hijos y esta familia tenía que irse a trabajar. Ahí fue donde pues yo no pude quedarme de brazos cruzados y así es que abrí las puertas de mi hogar para personas que tuvieran esas necesidades, conocidos míos, amigos míos, gente con la que trabajo en el día a día que sentían esa necesidad. No tengo dónde dejar a mis hijos, así es que yo decidí abrir las puertas de mi casa, pues yo estoy aquí con mis hijas, disfruto tanto la experiencia de estar con los niños, así es que bienvenidos a aquellos que lo necesitan. Y le he llamado un viaje inesperado porque yo comencé a capacitarme como yo podía, buscar cursos, primeros auxilios, acondicioné mi hogar para hacer un espacio más seguro para los niños, conseguí libros y hice todo por mi parte para empaparme de esta nueva trayectoria que había escogido. Comencé a compartir todos estos conocimientos con las familias de los niños con los que yo cuidaba y hacía todo lo que yo pudiera ayudarme para entender cómo cuidar mejor a los niños y lo iba haciendo poco a poco, paso a paso. Es una experiencia que se va ganando con el tiempo, con las ganas de hacerlo mejor. Entonces, así empecé yo. Después empezaron a llamarme otras familias y una familia más y me decían, es que sentimos esa confianza y seguridad de que nuestros hijos estén contigo. Me decían, prefiero que estén en tu casa que llevarlos a una guardería. Siento que tú estás más con ellos, que tú hablas más con ellos. Porque el cuidado en casa, el cuidado en el hogar, tiene esos encantos, tiene ese toque hogareño, el toque de cercanía y de refugio para los niños, y no solo para los niños, sino también para las familias. Es maravilloso porque creamos pequeñas comunidades en donde compartimos acerca del crecimiento y el desarrollo de los niños y formamos una especie de equipo donde lo que buscamos ambas partes es el bienestar de los niños y de las familias. Integrar a las familias es algo por lo que estoy apasionada. Am, Así que algo que he aprendido, una de las valiosas aportaciones de lo que me ha dejado ser FFN de cuidar en el hogar radica en que las cuidadoras compartimos nuestro propio espacio con los niños, la esencia de quienes somos. Compartimos nuestra mesa con los niños, compartimos nuestro sillón favorito con los niños, compartimos maravillosos recuerdos, nuestras fotos familiares, objetos que tenemos en casa, que tienen una historia y todo eso lo compartimos con ellos. Así es que las cuidadoras en el hogar no solo abrimos las puertas de nuestra casa, sino que abrimos nuestro corazón con ellos. Así que, en conclusión, el ser FFN le dio un sentido muy profundo a mi vida y por eso es que me encanta lo que hago. Y sé que tengo muchas compañeras que hoy nos están escuchando y que sienten lo mismo, que sienten esta misma pasión. Quiero decirles que no se rindan, porque nuestro deseo es ver más niños felices, sanos y seguros, y que no se desesperen, porque cada paso que dan cuenta y no estamos solas en este camino. Y yo estoy muy agradecida con Homegrown porque ha sido una organización que te acompaña paso a paso. No importa si eres nueva, empiezas, vas comenzando cuidando un niño, dos niños, no importa si llevas muchos años de experiencia, no importa en qué parte del camino te encuentras, Homegrown siempre te abraza. Siempre hay maneras de explicarte lo que no entiendas. Siempre aportan algo valioso, una herramienta, un contacto, un recurso, una capacitación que te ayude a alcanzar el objetivo, a no desistir, a no rendirse. Así es que estoy muy feliz de estar aquí y adelante. Gracias.
Thank you, Lucy. Thank you so much. I'm now going to transition to Miss Tony and invite Miss Tony to reflect on her own journey as both a family friend and neighbor caregiver and now a family child care provider, but also as the leader of a coalition of a network of both family friend and neighbor caregivers and family child care providers in North Carolina. So welcome, Miss Tony, and I invite you to share a bit about your journey.
Thank you, Ms. Natalie. I'm honored to be on this platform. Thank you for having me. I started my journey when I was 18 years old. I've been in business for 42 years. I am a licensed provider in the state of North Carolina. I am also the owner and proud owner of the Family Child Care and Center Enrichment Foundation that covers the family child care providers and also the FFNs. I am here to speak on my journey because I was once a FFN, and I believe everyone that's underneath of my voice was a FFN until it arrives that you had to get a knock on that door. When they knock on your door and they tell you you have to be licensed to take care of children in your home or it would be a federal offense, most definitely I went to be licensed. A current being licensed, it took maybe $40,000 to $60,000 just to get my home approved to just open up a licensed family child care in my home. And there's a lot of restrictions. We're up under the umbrella of our own state. Each state has different regulations and rules that we have to follow. But here in the state of North Carolina, we're very strict on making sure that our children are safe and we have a high quality care. In my journey as being a family child care provider and under the leadership of some of the providers here in North Carolina, like MDC, we work with a community-based practice and we house the FFNs and we do a co-op group to we work together, we share information, we make sure that they have the resources that they need, they have the toolkit to move forward. We're not here to force anyone to be a licensed family child care provider because the money, the funding, the equity is not there. But guess what? All our children are coming to the homes where they trust. They trust us because we're in the home, because we're their family, friends, and neighbor. That's who I am. I'm your neighbor, I'm your friend, and I'm all of that, but I am still licensed family child care provider. I am also your state, North Carolina state representative, and I represent a lot of the family child care providers in our state. When I say I represent the family child care providers that's licensed, not only that, the FFNs is included. We recently just had a bad storm to come through, rolled through in September last year. In the Western Carolina, we had lost a whole lot of trauma housing, devastation. And we as family child care providers came together with the FFNs and we made it work with the help of Homegrown. We was able to help each other by lending our resources to each other. And I don't think there should be no partisan when it comes to FFNs and family child care license. We're all the same. We're running the same boat. We're actually carrying on each other's toes to make sure that our children are kept safe and sound. Like I always told them, we cannot move forward without each other. We can't do that. So my journey is really precious to me. And we'll make sure that not one person is left behind, because you know what? We're all doing it for one reason, for our children. Those are jewels that you cannot replace. And when you have a jewel in your hand, which is your baby, your children, and you look back on those children, you say, I thank God that I was there for those children. There's no labor on their head. They don't have an FFN or an FFCC. They don't have that labor on their head. They're just our children. We have high quality care. We make sure that our children are grown, ready to go for kindergarten. Our children beats any and everything that's out there. When they go, they're ready to go. They have all the tools that they need to become the next lawyer, the next doctor, that president. So I would like to say to you, Natalie, and this whole board, or anybody else listen to me, give us an opportunity to come together and write policies to protect each other. Give us the opportunity to have our voice heard. Let us be an implant in your state to allow us to work together and not bring agony and pressure. We all need to be on one accord. Even though I may have a license, this FFN has a license too, because guess what? She's a mother, just like I'm a mother. We have feelings. We know how to take care of children. We've done that. We've birthed children. So along the way, there's no difference than what we're doing. We're all in here together. We're here to bend and bridge this gap. And the only way we're going to bridge this gap is we come together as a whole, and we need to stand strong. We need to be able to write these policies. We need to be able to protect one another and where we're going, and speak and carry out and execute what we need to happen in all our states. We need to come together. And imagine 1971, when they was paying FFNs across the state until we had to become licensed. We're not going backwards. We're going forward, but we're going to change the laws. But we have to change the laws together. Either one of us can't do it by ourselves. We need your help to get on board and help us change these laws. And you know, I'm very proud to be up under the roof of Homegrown because of the work that they do, the extension arms that they have handed out in different directions. They overcover, they oversee us, they protect us, and we need to do the same for ourselves. We need to help protect each other. You understand what I'm saying? Go if they're in trouble, help. If they need to be hidden, hide them. If they need clothes, food, whatever they need, or I need, let's make it work. Let's make it work for the best of the ability of these children. So I'm here 100% in North Carolina, and you know I would travel if you need me. It don't matter who you are, FFN, Family Child Care License Provider, we're here all together. I'll come. If you need some assistance, you need resources, you need a toolkit, you need just somebody to say, I love you, call me, because that's what we're here for. We're here to help one another. And I just want to thank you, Natalie, for having me on this panel. It has been a joy. It's a joy. And thank you, Lucy. I appreciate you.
Thank you, Tony. You are such an inspiration to me and to many of us in this community. Elliot, I'm sorry that you have to follow Miss Tony, but I welcome you to the conversation to share a little bit about why you have been a founding member, funder of Homegrown, and why you continue to support the work of Homegrown.
Well, there's just so many good people in homegrown, and having to follow Tony and Lucy, wow, that's a tough act to follow. So yeah, we're one of the initial foundation members of homegrown, and we, Clandestine Philanthropies, we have an early childhood grant making program that focuses on improving the mental health and well-being of young children prenatal to age 5, especially those children from low-income families and under-resourced communities, including families from diverse and racial and ethnic backgrounds. And so we're especially interested in investing in models of care, and I say that broadly speaking because a lot of our investments are in the healthcare space and pediatric care, especially because that's where many children are touched by different systems. But childcare is just a huge opportunity to improve the mental health and well-being of young children. And I think Lucy and Tony just illustrated that so nicely in what you both said. And we're also very interested in policies and how things get funded to improve child well-being and or not funded as much as they should, as I think people have mentioned today. So we're especially interested in home-based care, and I include licensed and unlicensed and licensed exempt care because the families that we are most interested in helping are most likely to be using a home-based care. And this is where most infants and toddlers are served, and it's the care option that many parents prefer. So for all the reasons that I think Lucy and Tony have so articulately said, that there's opportunities for really deep, lasting relationships and consistent caregivers and routines. And we just recognize childcare as an opportunity to improve the mental health and well-being and affect the policy environment that creates effective, services for kids and improves the mental health and well-being, and as well as the funding models that serve childcare. And I think homegrown is so deeply involved in all three of those areas that we have been committed for a long time, and I anticipate that we will be for many years in the future. So I'm grateful to hear stories like Lucy and Tony tell. It's just inspiring.
Thank you, Elliot. We obviously couldn't do what we do at Homegrown without the support of our funders and members. Elliot, supports our decision-making and strategy, as well as, the resources that Homegrown needs to do the work it does. I'm going to ask a question for Lucy and Tony to just share for just a minute each, if you would. If you could pick one policy that you would change on behalf of Family Friend and Neighbor and family childcare, what policy would you want to see changed or made? Lucy, do you want to kick us off?
Claro, sí, definitivamente hay muchas políticas, pero yo creo que una de las principales es acerca de la justicia de los salarios. A pesar de ser un trabajo tan importante, tan fundamental, porque no estamos trabajando con hojas, no estamos trabajando con computadoras, con objetos, estamos trabajando con vidas humanas. Y estas vidas humanas están en el marco del desarrollo de toda su composición en cuanto a su cerebro, en cuanto a su crecimiento. Es vital el tiempo y el esfuerzo que se le imprime a los niños en esta edad. Entonces, es increíble que los salarios realmente no sean justos, que haya una competencia terrible, injusta en cuanto a lo que hacemos en casa con lo que se hace en un centro. Entonces, deberíamos de buscar principalmente estabilizar los salarios, que haya un reconocimiento de la labor que hacen todas estas personas en casa, todos estos familiares, amigos y vecinos que se dedican a esto, y lograr que seamos reconocidas y remuneradas. Todo en cuestión de salarios, en cuestión de salubridad, en cuestión de prestaciones, vacaciones, en todo eso estamos descubiertos. Para mí sería una política que urge cambiar. Gracias.
Thank you, Lucy. I agree. Go ahead, Miss Tony.
I think one of the policies that need to be changed is to take the federal law off the book. federal criminal law off the book. I don't see why our states would want to criminalize someone that's taking care of children. And that needs to be a policy that's written in stone, where it cannot be changed. And another policy I feel like that we needs to be equal to a point to where we needs to share, collaborate together as a team, not as individual, not as different groups. We need to be on one accord when it comes to speaking about our children. There's so many laws and policies that I can speak on, but that first one resonate with me because we don't need anybody to be afraid to take care of children, because our children are coming home 3 and 4 and a 7-year-old's taking care of them because there's no one there to take care of them. And it's a shame that our states are so out of date. It's time for them to wake up.
That's right.
Bring it to another level to where we are, because our children is the most important thing. We have to do that. We have to put that law, that audience in law. I need to do that. And I'm working on that right now.
Well, I have every confidence that you will get that law off the books, Miss Tony. But I totally agree. You know, the work that home-based childcare providers are doing is an asset. It is a blessing, and it is a gift to a community. It is not something to be criminalized. Thank you so much, Lucy, Tony, and Elliot, for sharing your expertise on this panel. We really appreciate you. We're going to now just share a couple more thoughts and invite you to join us on our journey and be a part of our community. So, we want you all to know that, for homegrown, our work is sort of with providers and caregivers leading the way in deciding on, designing, and implementing the solutions we advance. We think about our work around these 3 buckets. One is to build grassroots power to ensure that providers, caregivers, families, and the children that they serve have power and influence in the childcare system to make and determine policies. And we do this through activating and supporting provider leaders, through expanding provider voice and influence in the system, and by resourcing and strengthening the home-based provider networks and provider-led organizations. We want to shape the narrative and ensure that the home-based childcare sector and its providers and caregivers are valued by families, policymakers, and the public. And Homegrown works to be a trusted hub of knowledge to support that, as well as amplifying evidence and provider stories that demonstrate the value of home-based childcare. And lastly, we are hoping through all this work to really reimagine the policies and systems to ensure that local, state, federal policy and resource flows are inclusive of home-based providers and the families and children that they serve. We seek to build evidence and advocate for inclusive federal policies that value home-based care, to accelerate state and local policy and program innovation, and to build and support inclusive state and local infrastructure and systems that support home-based childcare. We really invite you to join us. We hope this webinar is a way for you to get to know us and to learn about the community that we are building together, a community that is mission aligned, that is values driven, where all home-based providers have a seat at the table and a voice in designing the future of the childcare system. We invite you to connect with us in a variety of ways, including by joining us. We have a form that we're going to post in the chat. We welcome you to share with us, the work that you are doing and how you might want to engage with Homegrown around supporting that work. We have some calls to action and some opportunities for you to get engaged with us in advocacy work together. So we have the form in the chat and welcome you to fill it out. It'll just take a couple of minutes, but we want to hear from you about how we can be investing in supporting your journey and your effort to make a better childcare system. And then we invite you to be in connection with us. The best way to know what we are doing is to join our email list and to receive our newsletter. Our newsletter comes out once a month. It comes out in both English and Spanish. And we share resources, we share news updates, we share policy resources with our community in that space. So we encourage you and welcome you to join us there. So in closing, I just want to firstly say a huge thank you to Vinette on my team for co-presenting with me today. I want to thank Haley and Lucy and Tony for sharing their experiences, both as home-based childcare providers, but as fierce and inspiring advocates for all home-based childcare providers and the families that they serve. And I want to also thank Elliot for joining us today and for supporting the work of Homegrown. A couple of things that you can look out for coming up. On May 9th, we will be celebrating Provider Appreciation Day. So look out for that. And then in September, we will have our third annual FFN Appreciation Week. And this is really a time when we celebrate family, friend, and neighbor caregivers. We share stories and articles about how family, friend, and neighbor care is impacting communities. And we encourage you to be a sponsor for that week or join us in lifting and sharing the stories of providers and families during FFN week. So there are lots of ways that you can keep in touch with Homegrown. We're on Facebook, we're on LinkedIn, we're on Instagram. So if you want to take a moment to, find us and follow us on one of these platforms, we welcome you to do that. We often share stories that are written by providers or that highlight provider experiences, but also share resources that we have that are available to the community to connect with us around. And then lastly, I just want to say a final word of thanks to the funders that support the work of Homegrown. These are our funder members, and truly we would not be able to do the work that we do without their funding and support. So just want to take a moment to recognize the generous support of our funders. And with that, I will thank you all so much for joining us today. We hope to see you in future conversations and be connected with you online and in other ways, and are really grateful for the work that each of you do to support families in your community. And we're excited to be in community with you. Thank you all so much.